First, my name is Rashid and I am working as Emergency Medical Officer in CVSKL. Apart from that, I have done telemedicine since 2017 for various telemedicine platforms. And I was invited in 2018 to join Digital Health Malaysia to come up with new framework for telemedicine. Before I go further on telemedicine, I just want to clarify one thing. I'm not an expert here, and I'm not representing any telehealth providers here. I'm just share my knowledge and my experience using telehealth in Malaysia. Telemedicine, some may call it telehealth or virtual consultation or virtual clinic. All of them means only one thing: delivering healthcare service or medical consultation and treatment for remote patient via means of telecommunication technology. There are three ways of doing telemedicine. First, you can do chat or text message. The second one is audio consultations. That means using your phone to do consultations. The third one is video consultation. Among all of three, the most preferred is video consultation, simply because you're able to verify identity of the patient by seeing the patient in person. You're also able to assess whether the patient looks unwell or intoxicated. If that's the case, you have to stop the telemedicine consultation and suggest the patient to come to clinic for face-to-face consultations. What are the type of patient you may get in telemedicine? First is a new case. That means you have not seen this patient before and you does not have existing record of this patient, or it could be your old patient but with the new symptoms. You depends on the patient to give all the information, and you have to come up with diagnosis and treatment plan based on what they tell you. This method is least preferred in telemedicine simply because it has high chance of committing error and lead to medical negligence. Some of the new case, I suggest you would advise rather than give consultations which lead to diagnosis and treatment may lead to medical negligence. The second one is existing patient. This is pretty simple and straightforward. You know the patient, you have done face-to-face consultation, and you have carried out physical examination before. This patient simply come for follow-up and continuation of care. In fact, MMC guidelines say the same. You can only do telemedicine for existing patients for continuation of care. But then, I personally feel that telemedicine also can be used for new patients, but you consider as pre-consultation. That means you use teleconsult to get history from the patient of their presenting illness and ask the patient to come for physical examination. This is pretty simple, right? You also can do triaging. If you think the patient need to be referred hospital rather than come to clinic, please do so. If you think that a patient need to come immediately, you can always book the appointment via teleconsult. In medical indemnity, if you go through any medical indemnity policy, they always say one thing in common: it is your responsibility to ensure that you practice in accordance with any applicant law and regulation. What you should do during video consultation? Video call. It is simple mnemonic to follow. Verify the identity of the patient. Just like phone banking, you have to make sure the patient that you consult is the right person. Introduce yourself and do digital sound and video check. Poor audio will lead to poor communication, and this will lead to many errors. Evaluate the patient condition. If you think the patient is not suitable for teleconsult, by all means ask the patient to come face-to-face consultation. Obtain informed consent. If you need to record the session, please get the consent from the patient. Convert into physical examination. Like I said, you always can convert into face-to-face consultation if you think it is the right thing to do. Allocate enough time for the patient. Teleconsult is not something that you can do within few minutes. As you know, 80% of the diagnosis is made by a proper history taking. Limitation, explain to the patient. Know your limitation and explain to the patient. Lastly, follow up. If you give treatment via telemedicine, you must follow up. Most of the doctors forget to follow up the patient. You never know whether the patient is receiving the right treatment. What you don't do during video consultation, do not assume the identity of the patient. Always ask the patient. Do not make any diagnosis if you are not sure. Do not assume any information if you are not sure. Always ask again whether that's the right thing they said or not, and reconfirm back. Please do not provide treatment unless you are confident about the diagnosis. You can always give advice to the patient. Finally, I want to give another mnemonic for you to remember. Be smart. Secure consent. Maintain confidentiality. Adopt good communication. Recognize ability and limitation. Treat the patient with confidence. A lot of doctors misunderstood the importance of telemedicine. Most of the time, it's not always about giving the treatment. It's how you guide the patient to get the right treatment at the right place. Thank you for watching.